Well, welcome everyone to our ET Talks meet and greet. This was a special request by our patient council for this particular ET Talks. If you're joining us for the first time for ET Talks, so we do like to host these typically once a month and bring you all kinds of different information about essential tremor. If you have essential tremor, if you are a caregiver for essential tremor, we always have a Q&A time, but this time we're definitely going to be very interactive with this. Sometimes we'll start with a presentation and then do Q&A at the end. But this time we're bringing up everyone who would like to come up so we can chat, and you can chat with our founder, Diann, and we have Randy, who's one of our board members. We have Jason on our patient council as well. And I am the president of DSF at the moment. And Chris, we are glad to see you here. Welcome, welcome. And Betty, we're glad to have you as well.
Yes. Yeah, this is a relaxing forum for us.
Yes.
Many people call it the round table. I don't know what. Now, we will put this out there, for the group to listen to. So I just want you to understand, you're not alone if you're on this, if you join our panelists and you have ET. I have ET and I'm out there, and it's okay to show everybody we shake. So that's all right. So if you want to join us, you're welcome to. Now we have questions and we have other things we want to talk about today. And please, like Darlene said, on the Facebook group, you can leave messages or whatever, and ask questions if you want to. This is a chance. Darlene is a neurosurgeon. She is someone you can talk to and get some of your questions, answered. We also, most of us have ET. So, we can discuss what we're all living through. And the thing, my go is, you're not alone. You are not alone in your tremors. You don't have to sit there and think, everybody's looking. Everybody's looking at me. I've got to hide. I hide these things. No, don't hide your tremors, because you're not alone. We're here to help. And so, Chris, Betty, do you have a question since you're on board? Do you want a question to ask any of us? No questions? No, okay. Oh, okay, Chris, unmute. Can Chris unmute?
Yeah, did that button come up on your screen?
There.
Okay. I know if we're on a cell phone, it can be a little tricky to get unmuted.
Yeah. Let me see.
Oh, there she is.
There we go.
Excellent.
That's okay.
It's not so much that I have a specific question, but I do appreciate that I have learned so much through some of the support groups that were offered through the International ET Foundation. There's a couple. I live in the state of Wisconsin. There's a couple in the state of Wisconsin, so I've attended those. I've read a lot of information over the last many years. I've had noticeable ET for 25 years. So I've read a lot. I think I've learned kind of a lot about DBS and focused ultrasound and the medications that sometimes help and sometimes don't. The people in the other Facebook group are going nuts right now talking about the Willem ball. Like that is the only thing that they're talking about. And it's interesting, but I had to stop following for a little while because I wanted to think about something other than the villain ball. So anything that you've got to say, I'm all ears. I do see myself uh, a candidate for DBS at some time in the next several years, and so I want to make sure I'm ready for that and that I'm getting to the best surgery center for the best outcome.
Yeah, those are definitely important things. I will speak to the DBS side of things. First of all, so yeah, regarding where to get that done, you definitely want it done by a neurosurgeon who is fellowship trained in deep brain stimulation. So they've gone through movement disorder fellowship like I did. I went through a year-long fellowship for that. And in general, in a center where they have a whole team approach. So like what we're building here in Bradenton, what I've built before in Jacksonville and in Cleveland we have a movement disorder neurologists we work with. We have neuropsychologists that we work together to evaluate the patients. And I think that's really important because then it's not just one doctor kind of guiding you as far as, well, we think this will be a good idea or not, but it really is a team approach. And then you as a patient are very involved in that decision making as well, because there are risks, of course, with DBS, as with any other surgery. It's one of our lower risk procedures that we do in neurosurgery, but there still are risks that's important to be aware of. And, I know that at our center, we definitely like the patient to be very involved in that decision-making process as well. And be sure you get all your questions answered. So if you have specific questions about a center, you can feel free to reach out to us. And I know most of the neurosurgeons that do these procedures in the US at least. So I'd be happy to chat with you offline about that as well. And then Jason, you wanted to share something?
Yeah, I recently went through Dr. Sebastian Koga is my neurosurgeon, and I just recently went through DBS. Not, pardon me. He does. Pardon me. I just choked on some gum. Sorry about that. In September he did my right side for my non-dominant hand. Waited 3 months and did left hand and installed the battery, the first surgery, and installed, then connected it on the second surgery, December 6th. Betty, I can tell you this. I think Dr. Lobel's exactly right. It's a team approach. And Dr. Koga's team, he will only work with certain people, and he has anesthesiologist works with, and Catherine, his physician's assistant, is unbelievable. And I had a Medtronic system put in, and he went through and discussed all that. I met with Medtronic and the Medtronic rep that only he uses, and because there's 2 in the area. So the team approach is truly, I can't agree more with that. And finding a neurosurgeon that is going to have a team approach. He also reached out to my primary physician, in addition to doing a brain mapping MRI, and it was a full thing. So that when it was done, when the surgery was planned, we were making sure everybody's dates, because we had to have a guy that came in. He's working with the doctor locally in Louisiana that is learning how to program the programming end of it. So, when they wake you up in the middle of surgery, I've got this blue sheet here, and and everybody, and he wakes me up, and I'm bright-eyed and bushy-tailed. Now, of course, you can't. I can move my shoulders and everything, but the thing I liked about the Medtronic system that I use is there wasn't a halo in front of me, so I didn't feel as claustrophobic, but I was completely secure, so I couldn't move. And of course, you don't feel anything because there's no feelings, in the bone. And The only thing I did feel afterwards was a little, because the brain is compressing, you know, on the electrodes. My speech was a little sluggish at first. It's getting better. Whichever side you did was a little sluggish, and it's all temporary. I think the faster, you know, the two biggest things he said, or the three biggest things he said for me were, you've got to sleep, because sleep is where the brain heals itself, and it gets to a specific level of sleep. It's not even the dream state. It's like a delta wave, I believe is what he said.
Yeah, deep sleep and delta. Yeah.
And drink lots of water. And when you can, get out and walk, because even slowly, and at first with, you know, he said the first week, he just wants me laying around the house, but building up your strength as soon as possible as your body is able to. And I can't agree more with what the doctor has said here. I do have a question about, and I haven't talked to Dr. Koga about this. Have you heard anything about DBS affecting the taste buds? Because now I have like things taste a little more bitter on the side of the tongue.
Mhm.
So I don't know if that is something or not, that may or may not be a contradiction. Or
So where we place the leads for essential tremor, it's in a specific area in the thalamus, and your thalamus is kind of your relay center. So everything in your cortex goes through the thalamus, then goes to the brainstem, and then, you know, we'll go to the taste buds, right? We'll go to the arms and the legs and whatnot. So it's not something that we commonly hear, but certainly because the leads are in the thalamus and everything passes through there, it's possible. I would say that you still are in a very early stage, and what you were describing. So there's always, anytime we implant something in the brain, there's a little bit of swelling around that, which is temporary, that will resolve, but you can have some side effects for the short term. It's also the reason why we don't turn on the stimulator right away, right? We let the brain heal a little bit and then turn it on. But there's so many programming options nowadays with the leads, which is one of the things that I love. I'm glad you had a frameless system. I use a frameless system too for my patients as well, because it's much more comfortable. But yeah, the programming can be adjusted. I've found that when we're programming individuals for the first time, there are a lot of visits in those first few months. And then after that, it's really more maintenance. So, you know, every 3 months, every 6 months, something along those lines. But a lot of tweaking can be done. So you can have them play around with that programming and see what they can do with that.
Well, I'm doing my own programming so far as increasing Medtronic, because I'm a little bit more proactive than some are. They've asked me to be part of the Medtronic advocate system or whatever. I don't know what that entails, but I'm able to program a millivolts, and they do have an MRI mode. My wife and I went to go see Journey and Toto in Biloxi, Mississippi last night. And I went up and I pulled out my Medtronic card and I said, I got a battery. I need to go around. And so I didn't go through the radar, because, you know, what Medtronic told me is all it'll do is it'll turn it off. Well, I can't carry my Bluetooth puck and my little tablet with me wherever I go. So I went around, and then I told the guy who was waving it down with the wand, I said, man, I got a battery. Unless you want me to start shaking, don't wave it over me. He goes, oh, you're one of those. Turn around. He just got my backside. He said, okay, we're good. So in airports, but the only other thing that I have found in both Kathy, my Medtronic rep, and Dr. Kogas and Catherine, who's his PA, had said, oh, it was 2 weeks after my first surgery. I was like, Dr. Koga, I've got a sales conference in Salt Lake City, and I'm in the greater New Orleans area. I said, I've got to fly. Is it safe? He goes, oh yeah, it's fine. Well, if there's something that can be the far-reaching problem, that's me. So at certain altitudes, going up and going down, I thought I was coming unglued. And it was only for like 15 minutes. It was a certain altitude. And he goes, oh, and I asked him about it afterwards. Oh, yeah. He said, your brain was just swelling. I was like, my brain is just swelling. Why didn't you tell me
Yeah.
that?
Yeah.
Because it was a unusual pain.
Mhm.
But he said, next time, take some Valium and take something, like he said, come call me if you got to fly again. I said, well, I'm not flying anywhere anytime soon. So I got another conference coming up the week after next, and I'm driving to it in Dallas.
Okay.
So
Yeah.
I'm not. I was just curious about that with the lead, because I, like you said, I do know the Medtronic has 4 different ports on the bottom of it, and she was explaining that we can put a certain amount of voltage. I'm at 1.9 on my right side left hand and 1.1 on my right side dominant. I am having to relearn. I'm going through some hand therapy to kind of relearn. 25 plus years when you deal with learning to work around the tremors and work around the disability, sometimes you need some help in retraining. So I would encourage anybody that's interested on here that is in deep brain stem, do it. Do it. It's a life changer. It's the only thing that worked. None of the medicines work for me. I'm one of those weird guys that if there's going to be something odd goes on, it's going to be me. None of the meds worked. So I just, I stopped being a performing musician, a touring musician and studio musician. Got my guitar right down here. I picked it up and played it for the first time recently. And it's because of deep brainstem.
Yeah,
Wonderful.
It was amazing. So highly recommend it.
So good. Well, I'm
And
so
no
glad.
stomach problems. No stomach problems with DBS either. With
Yeah.
meds,
Yeah, I'm so glad you had a positive experience with it. That is wonderful. It's great for you to be able to share. And yes, Lorna asked, we are talking about deep brain stimulation right now, and Jason has just had that. And yeah, so typically I tell patients not to fly for the first month after the brain surgery, part of it for that reason, because certain altitudes cause problems like that. But glad you had a good experience with that. Okay. All right. And let's see. Betty, did you have a question? Oh, I think you're muted.
Okay. Can you hear me now?
Yes, we can hear you now.
I wanted to say, Diann, I have followed you for a very long time. And you too, doctor, and you're just a wonderful person. And I wanted to also share that I'm from North Carolina, and I run a support group on Facebook, and I've been running it for quite a while now for people that have essential tremor. And I've met so many wonderful people on there that have joined my group. And we're going strong, getting the word out. And my question is, doctor, is there currently any new medications that you know of that are going to come out for ET in the future?
Well, thank you for asking that question, and thank you for what you do for Essential Tremor. That is amazing. Yes, in fact, we have been working with a number of companies that are in what's called phase 3 clinical trials. So they are studying the efficacy of different medications, and phase 3 is what we see right before those get approved and become more publicly available. So you're going to see very soon, we're hoping to have this ready by March, by ET Awareness Month.
Oh, wow.
We're actually going to have a little quiz you can take to see if you qualify to be in the trial. Okay. And it's going to go through inclusion, exclusion criteria, but make it a little more user friendly. I don't know if sometimes we go to those websites, and even me as a doctor, it's like, oh my goodness, this can be a little bit overwhelming. So one of the things that we like to do here at DSF is make it very user friendly for you to figure out, are you possibly a good candidate for the clinical trial? And of course, most of these clinical trials, they're called randomized. So one person will get the actual treatment drug, and then the other person will get what's called a placebo. But they often, some of them actually have a crossover. So if you had the placebo for a while, then you will get the medication eventually. And it's a good way to kind of get your hands on some early treatments. You should also know, and we're going to be having some ET talks coming up very soon, where some of these companies will be coming in and talking about their phase 3 clinical trials, but they've been through phase 1 and phase 2 trials already, which is very important because they've tested and achieved a certain level of safety. So phase 3 is, it's not as risky, so to speak. Of course, there's always a risk with any kind of new medication that you're trying, but it's not as risky because it has been through extensive safety protocols by the time it gets there. So we should have that quiz available for you guys, hopefully by early March, and then you can see what's available in your area. And I know there's one company in particular that is able to do all of the visits remotely, so it actually doesn't even matter where you live. So as long as you don't have any of the other exclusion criteria, then you can participate in that trial. So yeah, so stay tuned. And we're very excited about this because, as you guys know, it has been decades since we've had any really new advancements medication wise. But as researchers, we're starting to learn a little bit more about what causes essential tremor, what those pathways are in the brain, what the chemical changes are in the brain related to essential tremor. And that has led to the development of some of these new medications. So the research arm that we also very much support is very, very important. And so we really appreciate all the support we get in from that side as well. So.
Sorry,
Yes,
guys.
I know in March, I do know March is Essential Tremor Awareness Month.
Yes.
So I tell my group, get the word out, guys and girls. Get it out there.
Well, that's what we're going to do. And sorry, guys, somehow I lost all of you. I could see you, but I couldn't hear you. So I'm back on. And yes, March is very important to us. I hope I'm not going over what we talked about. This is also, I don't know, Darlene, if you brought that up, since I haven't heard some of this stuff. This is our 10th year anniversary.
I haven't mentioned that yet.
Oh, right. Well, this is, and March is very important to us because 10 years ago, I decided the foundation. So this is going to be a celebration of ET. Can you hear me?
Yes, we can hear you great. Absolutely. Yeah, your video feed's
I'm
a
off
little
again.
patchy, but your audio is coming through just fine. So
Can you hear me?
we can hear you fine. Yeah.
Okay.
Yeah.
Well, all of a sudden everybody froze and I don't know what's happening. It's strange, but yes, March 10 years ago, I decided to start the foundation. My book, A Faded Cottage, was published and out there, and that is what began this whole thing. And yes, Betty, this is what my dream is, to make everybody in the world understand what essential tremor is. This is going to be the year of ET for us. And anybody wants to join us to make this happen, go for it. Because doing it alone is not going to be the answer. Because that is what we've all done. We've all stood out there alone. We've all thought we were the only person with ET. We're not. And we're standing and we're united And March, anything, if you can do an ET story. Darlene, Dr. Lobel is, she is interviewing everyone who wants to tell their story. It can be short, Darlene, right?
Yeah,
It doesn't
absolutely. It
have
can
to-
be 5 minutes. It doesn't have to be long. In fact, most of the interviews are 15 minutes or less, but some of them are 5 minutes. And
Yes.
I'll tell you, we did this last year. I did a number of interviews last year, and I'll put up a link in the group for anyone that wants to be interviewed for ET Awareness Month too. We'll post that video up, but a lot of people were a little timid coming on the interview with me. It's not done live, so it's pre-recorded, so you don't have to worry about that. So it's possible to edit if we need to do that. It's no problem. And then we'll post it after, for the Essential Tremor Awareness Month. But a lot of people, they would come on and be timid. And then after they started talking, you could just see how excited they got to be able to share and being able to come out of hiding, like Diann, you described so well, right? To come out of hiding and to share your story. I'm telling you, folks, it is freeing. It is very freeing, and you can just see the joy on people's faces. And so I encourage you, even if you're a little nervous about it, it's okay. Just come on and let us interview you. And we should have quite a number of stories posted. We're going to try to get at least one every other day, and who knows, maybe we'll get one posted for every day during ET Awareness Month this year. We had probably, I guess, eight or nine last year. So
That's what we want to do, and it's okay. I want everybody who's listening to me to understand it's okay to tremor. It's okay, because everything I've got, my whole body tremors, and that is what the story is going to be. We have plans for this year. Oh, we're going to make it happen. 10 years, we have changed the way the world sees ET. And Darlene, I caught a little bit that you guys were talking about. We do have, clinical trials going on. We have the pharmaceuticals talking and interested in us. We are going to be on top. We're going to be out there that people are going to say, oh, you've got essential tremor? Oh, I understand. Because we all know if you say I've got Parkinson's, okay. But, in the past, essential tremor, nobody knows. But it's not going to be that way this year. So, okay. Darlene, have y'all answered any? I know you've answered a couple questions.
yeah, we did. There was one follow-up question in the chat just to put a button on the DBS discussion, I think. So we were talking about, Jason was talking about his experience flying right after DBS. And the question in the chat is there an altitude that is more significant with DBS? And it doesn't have to do with the DBS. So it had to do with the fact of the timing of when he had the brain surgery. So any brain surgery you have, I typically tell my patients, this is just my personal view, is if for at least 30 days, don't fly afterwards, because there can be swelling in the brain around the site of the surgery. There can be air in the head. And when you hit even above 10,000 feet, which most commercial flights are doing, right? Unless you're just doing a little hop, skip, and a jump. When you hit that altitude, it actually increases intracranial pressure in absolutely everyone, okay? Which is, one of the reasons we tell you to do and not do many of the things when you're flying, right? But so DBS itself doesn't cause any problems once it's been in for a little while. It's just immediately after the brain surgery. So I wanted to.
So can I create a T-shirt that says, "I am an airhead, I've had DBS"?
Oh, that's beautiful. I love
That's
it.
perfect. That's a T-shirt. Diamex Foundation, Essential Tremors. We'll put the logo under that. I am an airhead. I've had DBS.
I love it. I love it. So good.
Oh, goodness.
Yeah.
Okay,
We did have a few questions come in with the forms, but we want to honor also the people that are here right now. So if you're here and you're on the Zoom and you have a question, go ahead and ask that, and then we will cover, don't worry, we will cover folks' questions who submitted with the registration form as well.
all right.
Okay.
Um,
All right. Well, I can, while you guys are thinking of your questions, I can go through some of these. So Stephen had asked, what is the probability of developing both essential tremor and Parkinson's, or developing Parkinson's if you have essential tremor, which is a great question. And probably 10, 15 years ago, we would have said from the medical community standpoint, that's not very common. But now that we've studied that, okay, what we've discovered is there's almost a 20% crossover, and that number may even be higher because, as you know, essential tremor gets underdiagnosed a lot, right? So, but the statistics say that there's about a 20% crossover with essential tremor and Parkinson's as a combined diagnosis. So it's really important. This is one of the reasons why we talk about, please see a movement disorder neurologist, right, for your diagnosis, so that they can tell the difference. You know, it's interesting to me in my practice now, when I see patients in the hospital, and a lot of times, you know, someone will have said, oh, they've been diagnosed with Parkinson's disease, and I go in and they don't have a resting tremor. They don't have any stiffness. And I ask them to pick up their cup and they start shaking. And so I do the evaluation and I say, that's not Parkinson's, right? This is essential tremor. So it's really important to be evaluated by someone that just has the experience seeing these different types of tremor, because there's a lot of different types of tremor. I mean, there's cerebellar tremor, right? There's a natural tremor, a physiologic tremor that everybody has too. So really important with that, but that is in answer to that particular question. There was a question, we already talked about the new meds, so we handled that. Somebody asked, Patty asked the question about how she could support her mom who has essential tremor. And I think that question, I can answer it certainly, but I think it might be better answered by Diann, if you want to answer that.
Well, the main thing is essential tremor is a disability. And we need to understand that if your mom or somebody has any other disability, how would you treat them? You know, for me, don't over analyze what essential tremor is. It is the tremors, and you have all the rest. You have the voice, you have the head, you have everything. Understand what your mom is going through. You know, don't criticize, but don't hide your questions. You know, people around me a lot of times don't want to discuss my tremor with me. They think that if they just ignore it, it's going to go away. Don't do that. Now, Chris, Janet, Jason, Lorna, you can answer this too. For me, I like people to, even family or whatever, to ask questions about my tremor. You know, I hide it. I try to hide it, you know, all these years, but now I can't. And I do see people who, you know, are looking like, oh, you know, what do we do? Do we grab this? No, let me do it. I'm kind of like the little dude. I can do it myself. I'm going to make messes. I'm going to make mistakes, but watch for those signs. Watch for, there's certain things that I really could use help on. And I know you guys are the same way. And if you want to do a little help and support, do it. But don't just jump in there and say, I'll do that for you. You can't do it. No, I can do it. You know, so that, I don't know if you guys have another thing. I'm very independent.
I'm su-
Always
I
been
can say this.
independent.
I'm super independent as well. And I think the hardest thing for me is, as you know, a husband with tremors, is finally getting to the point when because I'll get frustrated and I'll just start, you know, and I couldn't hold the glass, and I would have to hold it up against my chest and kind of with a straw, and I think that, you know, I resonate with what you were talking about. I'm so independent. Um, and my wife was waiting for me to acknowledge that I needed the help, because she knew that I needed to come to that point in time when, okay, I need help. And the same aspect is when I started, you know, researching what was available. And I guess that's coming from the patient versus the caregiver view. But I think that having an open and honest discourse and conversation, and do it in passing. Do it in passing. Don't do it, you know, and just, you know, offer, say, hey, you want me to get that for you? No, I got it. Okay, cool. And
That's
just walk
it.
on and walk on. If you don't make big of it, it doesn't become a big thing from the caregiver side. We as the I guess the patient or the individual dealing with it, I hate to use the word patient because I don't feel like I'm a patient. I'm impatient, but I'm not a patient. You have to get to that point when you got, you know, the person you're loving and you're caring and helping. It's going to get to the point when they have to say, okay, I think I need a little help, but you can't make them get to that point. But when they do, you know, be there and just be there when they ask for it. Because if they're going to get to that point where they have to ask, then I think that's the point when they're, you know,
Yeah.
that's when you offer it. And that's a
Janet?
hard place.
It is. Janet?
I just want to add that I notice more now, I will say, I could use a little help today. Could you take this tea cup to the table for me? I don't think I'm steady enough today, my hands to carry it. I always preface it by today, because another day I might be okay. And I notice that sometimes some of my close friends will say, if we are out having lunch, it's interesting, pouring the coffee from an urn or the tea. One of my friends will say, can I do that for you? And I'll go, oh, yes, or no, I'm okay. And that's okay. I'm fine with that. Yeah.
That's a good thing, because I like that, because that is what I pretty much was saying.
Yeah.
You know, you can ask, but don't make a big deal about it. You know, everybody needs help. It doesn't matter who you are. I've got friends that, you know, need help doing all kinds of things. So ask. If they don't need help, then that's okay. So from the caregiver, as you say. So yes, you know, it's no more than if you're out in public and you see somebody who is tremoring and they need a little help. I've had that at the grocery store when I'm bagging my groceries. People will come up and say, I had one man who was checking out behind me, and I was trying to bag the groceries, and he walked up and he said, can I help? And I'm like, sure, you know, go ahead, because it takes me so much longer to bag groceries. But if not, you know, don't take it personally. If you know, whoever you're asking with ET doesn't want help, that's okay. we are independent. I think that's part of our DNA of being essential tremor patients. We're very independent. So what's more questions, Darlene? Do we?
Yes, so there was a question about assistive devices. And so as you may know, there's a number of assistive devices that range from weighted utensils, weighted pens, to some of the newer devices. There's the Calitrio that you wear on one of your wrists, and it essentially captures the frequency of your tremor and delivers impulses in the opposite to kind of negate that, to help. There's this new device, the villain ball, that we started talking about at the beginning. And actually, Dr. Christensen, our CMO, is going to be giving us a full report about that soon. So I will await for him to talk more about that. But there's more and more, I think, as essential tremor becomes more well known and gets the attention it frankly deserves because of the prevalence of the condition, that we are going to see more and more different therapies being offered to help with, certainly with tremor, but also some of the other things that we see with essential tremor, which is really important to mention. And I know, Diann, you talk a lot about this, and I think that is important because in the medical community, I'll tell you what, when they teach us in medical school about essential tremor, here's what they teach. Well, of course, when I went to medical school, it was a different century, but anyway, Parkinson's has, all these different things, and then essential tremor, all that's wrong is tremor. And that is categorically not true, right? Anybody with ET can tell you that there's many other things that are affected, many organ systems in the body that can be affected, from your balance to even, feeling depressed or anxious, and many, many other things as well. And so I think as we see increasing awareness about the condition of essential tremor and everything that it entails, we're going to see more targeted therapies, either from a medication side, a surgical side where appropriate, or from assistive devices. So this is an exciting time to, be around because we're seeing so much development, I think. So
That is. And okay, everybody who's listening, if you can answer now, good. If not, please send us a message. My question: what is the most important message you want to tell people? That I want everybody to send me. That you can message me, you can on the worldwide group, you can do, I'm on all the social media. That is a question I would love to hear the answer to. What is the most important message you want to tell people? It sounds simple, but it can be very, complex. For me, I want to tell people it's okay to show that you tremor for the ET people. But what do you want to even tell the world? We're normal people. We just tremor. And as you grow older, it's tough because people think, well, you're old, so you're going to just shake. But then you have the group of people who are younger who are tremoring. So please send me that message. And there's many things like that we as a foundation need to know. We need to know what's happening with you guys. I'm one person. Of course, we have on the board and other people, essential tremor patients. But I want to know what's happening with the worldwide ET community. So please, if you can understand what I'm asking for and hear this question.
I have something. Diane,
So, yes.
I just, you brought it to my attention as you've been speaking. And I want to respond. I know it's quick, but it's been always there for me. Whenever I share with somebody now that I have essential tremor, and if I have to share what that is, I share what it is. And I've been sharing it for many years, but I always add, I've had it since I'm 18 years old, and I'm 69. And they always look at me like, oh, really? 18? And I say, there are some babies that have essential tremor. There are some young children that have essential tremor. I think it's so important that people know it happens across all ages. So that's what I want to add.
That is exactly right. I've even thought about putting the picture of me, because I was early 20s diagnosed, but I know I had symptoms before, putting a picture of when I was young, and this is me now, but I was this when this started tremoring. And that is something I've tried to explain to people. Like I say, now they look at me when you're old. I'm 68. So that,
Diane,
yeah,
They
one of
just,
the
you're young.
they just think you're old, and that's the reason why this is
I know.
happening. And I
That,
always add, and I was 18 when I was diagnosed.
and I like what you're saying is because many people just stare at you like, what?
Really?
You know?
Yeah, right.
One of the things, I did advocacy for the disability community for so long because of my daughter, 21 years going to the legislature and fighting. And the best thing that resonated with legislators. And by the way, Diane, I did reach out to both my legislators. I don't know if you saw it about
I saw that.
adding essential tremors, because Parkinson's is already added as qualified conditional for medicinal marijuana in Louisiana. I'm going for essential tremor specifically. Is that disability is no respecter of person. It's no respecter of socioeconomic, no respecter of race, no respecter of sex, no respecter of anything. It hits anybody all the time at any given time. So it almost is like there's no spectrum. There's no spectrum. It hits you. It can hit. Now there's spectrum of how you visibly may see it. 25 years ago, I wasn't shaking like I was in December.
Right.
It did progressively get worse, but it doesn't matter who you are. It can hit you at any time. Granted, majority of it can be considered familial, but that doesn't mean you're outside of the boundaries of. I got it before my dad had it, and it was from an adverse reaction to a medicine that I got off too fast, and then all of a sudden I started shaking. I had it a good 10 years before my father had it. So
Right.
it's truly no respecter of person. It hits anybody ever. That's why anybody can be disabled at any given time. You could be in a car wreck and all of a sudden you're just disabled, and you could be
Right.
36. You could be a child in a bus accident and you become disabled. You can get a disease at any time. It can happen to you. Now
Yes.
that's a scary thing that you don't want to portray to the public, but it hits anybody and everybody at all times. Or it can hit anybody and everybody at all times. I'm just like you. I'm shaken, not stirred.
Well, that's the key. It can be all of a sudden you really notice it more. And I think a lot of people have the symptoms way before. But all of a sudden some symptoms going to happen, and it doesn't matter what age. And that is another thing. That was one reason we're sitting here is because I didn't know that. Okay, this is 10 years for A Faded Cottage, guys. Get out there and get the book. A Faded Cottage is the reason we're here. I wrote that story. You know, I've put my other books on hold, but that book pretty much is the book that is reason we're here. A Faded Cottage is the story I wrote on my birthday, late one night, because I was mad. I don't get mad often because I have learned to handle things. I'm like, okay. But I felt sorry for myself, and that doesn't happen. And that's the reason I wrote the book. But 10 years ago, I wrote this book, and I got out there and I talked to people at book signings, and then I got other books. But they were the same way. Oh, you've got tremors. It's okay. It's not just me. When I started hearing the stories, parents coming to me, telling me their 5-year-old is having trouble in kindergarten and they're tremoring and nobody seems to care. You know, they think that, oh, well, they've got this, this, and this, and they write it off. But it is tremors. It is essential tremor. And when I found that out, I was like, we have got to change this. Even though, Janet, I'm like you, I was young when I started. I wasn't thinking about that. Duh. You know, if you're 18 in your 20s or whatever, that is young to begin to tremor and to be out there in public. And I had to do what everybody did. I hid it. And that is why things have got to change. And anybody wants to join us, please do. This is our year. Do whatever you can do to help us. Become an advocate. Become a part of our patient council. Jason is a part of patient council, and he is working. Really, he's out there trying to come up with ideas to make a difference. And the way we're going to make a difference is to unite the ET community. So I don't know, Darlene, you're back?
Yes, I'm back. Sorry, I'm playing a doctor on TV today. No, just kidding. I'm on call at the hospital. So.
That's okay. I know you're busy too. So yeah.
Yeah, so I think we hit almost all the questions. I'll just hit this very briefly. There was one question, someone is scheduled for focused ultrasound procedure, and this was Evan, and Evan asked about some details, so I'll just briefly touch on it. We'll go more into depth in this in a later session, but so some of the main differences between focused ultrasound and deep brain stimulation, both are considered surgeries, but focused ultrasound is non-invasive, so it doesn't require any cutting, okay? It does create a little lesion or a tiny hole in that spot in the thalamus where we would put a deep brain stimulator. So the deep brain stimulation is more of a modulation or reversible therapy, whereas focused ultrasound is more of a permanent decision that you would make for that. But for someone that is not healthy enough otherwise to undergo a brain surgery, the focused ultrasound can be a really good choice for certain individuals. And it has, for the last, I think since 2020, they can now treat both sides. So not at the same time, but they can treat one side and then treat the other side. That was not the case before 2020. But it's typically done as an outpatient procedure. And the efficacy, it's more of a newer procedure. So DBS for ET has been done since 1987. So we have quite a bit of data on that. And we do see about 90% tremor relief with DBS. With focused ultrasound, those numbers are still coming in. Some studies say 50%, some say 30%, some say 70%. So we're still gathering a lot of data on that and the longevity of the treatment. But just to briefly touch on some of those things, hopefully that helps you with that. And please feel free to, you can also make a post in the ET Worldwide group and we can come in and comment on that a little bit more as well.
Well, another thing we're going to do this year, we've got so many plans, is we're going to do a DBS and a focus ultrasound ET Talks.
Mhm.
So you will be able to join and ask your questions about each one and let them go back and forth. So we do have that planned. We haven't got dates on everything, but we have many ET Talks planned for the year. And if you have anything else you would like an ET Talk to talk about, you know, let us know what you would like to hear. Again, March is ET month. Join us, you know, join us with your story. Let your story get out there and tell the world, because that is part of our problem, is we've all hid, which I am very guilty of. I didn't let anybody see that these were going. So tell your story, because if we don't get out there to tell our story, then no one's going to understand what essential tremor is. So join me and let's get this done this year. Let's make a difference. So anything else, guys? If you have anything else or any other questions, I don't see anything. So I guess that's it. And we will see you in March. But please remember, you can message us. You can tell your ideas. We need all the help we can get. So thank you.
Thank you. Have a great day, everyone. Take care.
How do we message you?
On the worldwide group.
Oh,
Are you on the worldwide group?
the IETF, yes.
No.
It's Essential Tremor Worldwide on Facebook. It's
Oh, no, I'm not.
okay.
So tell me about that.
Okay, well, you can message me, Diann Shaddox,
Right?
on Facebook. Just Google, Facebook,
Okay.
DIANN Shaddox, SHADDOX.
Okay, Janet and I are both part of a group that we're meeting, Janet, on Monday, is it? Oh, you're muted. You're muted.
That's a separate support group, but I don't think it's Monday. But you're in a different time zone, so I'm not sure.
Yeah,
But that's different from Diann.
yes, I realize that.
Yes,
Yeah.
yes.
Lorna,
Janet?
also in the email that I sent out that had the link for this Zoom, there's a link to the Essential Tremor Worldwide Facebook group
Okay.
as well.
Okay.
So you can just pull up that email and get right
Okay.
into the group. Okay.
And Janet knows where we are, and you can message us. And anybody, contact Janet.
Yeah, I want to thank you for sort of making this group known, because I think the more contacts we have with people with essential tremor, it's better for us, but it's also better for everybody because it helps to widen the knowledge. I'm in Canada. I'm in the nation's capital, Ottawa. And to be honest, I don't know one other person with essential tremor. And if I didn't have these things, forums and these chats, I would never be able to speak to somebody who has essential tremor. Our population in Canada is only 40 million. and we're a very large country. And I'm sure there are other people, obviously,
Oh,
you know, in Canada with essential tremor, because this, occasionally I bump into them on forums. But personally speaking, I don't know anyone else personally who has it. So I think these forums and these discussions, they're very, very important for people.
yes. And there are plenty in Canada. We have many on our worldwide group, and we have many who have joined us. So yes, you need to be a part of this because you're not alone, for sure.
Yeah, and another thing, like I'm very interested, like in what Jason talked about. Like to my knowledge, in Canada, DBS is not even available. Focused ultrasound is available at Sunnybrook Hospital in Toronto, but to my knowledge, they do not do yet.
Lorna, one of the developers, early developers of DBS is in Toronto. So yes, I can get you connected. So
Yeah,
it is available.
I've been told that they didn't do it though, the surgery here. Yeah.
That's not correct. I mean, there may be a particular hospital where it's not offered, but it absolutely is offered in Canada because we have board certified neurosurgeons in Canada who are trained in functional neurosurgery and doing the procedure. So happy to get you connected with them. If you
Yeah. I do have a movement disorder specialist here in Ottawa. He's actually the head of the department, Dr. David Grimes. And it's very, very difficult to see him. In fact, I couldn't see him the last time because 5 years had gone by before I had seen him previously, and I had to have another whole new referral. And anyways, but there's, when you asked Diann if there's something that you want people to know, the first thing that came to my mind is what you said, Darlene, was that there's more to essential tremor than just tremor. And I think a lot of people, like even in my own family, I have to teach them, you know, that there is more. And connected to that, I think it's very important that people who have essential tremor know to get other things checked out. Not to just chalk everything up to essential tremor.
Oh, yes.
That there can be other things at play that may not be caused by essential tremor. And that has happened to me. When I was losing my balance noticeably, my family doctor, my general practitioner, sent me for a brain scan because she said it could be your essential tremor, but it might not be. And I do have a brain tumor. The news on it, I see the brain surgeon on February 27th of this year, but that MRI of the brain was in March 2022, and it's taken this long in Canada, you know, to see a brain. I've seen his resident once, and the news was pretty good. That brain tumor showed on CAT scan earlier, and it was missed, but it has never grown. And a recent CAT scan showed it was stable. So they don't think it's cancerous. However, it's pretty close to the cerebellum. And I'm wondering, you know, if my balance problems are caused by essential tremor or if they're caused by this benign tumor. And I think it's, if I wanted also to say what I would like people to know, is just don't chalk everything up to essential tremor. Investigate, check it out, make sure there's not something else going on.
Right. And that's a good thing because, you know, any disability, you can't just say that's because of something you have. And the other thing, though, is we are doing more research, medical research and everything to figure out what all ET, we've got the doctors now wanting to find out what ET really is. You know, what are not just the symptoms, where it comes from, what it causes. So hopefully in the next few years, we find more of that out. Whether, you know, we know balance does come from ET, but is that where your balance is coming from? So that's where the top movement disorder doctors need to be involved. So we do want people to talk to their doctors. So, and we're glad you joined us.
Yes.
Well, thank you for the group. I just, I cherish the opportunity to hear from other people because I don't know anybody personally who
Right.
has.
Well, that's what
Now
we're
you're
here
connected.
for. You are, and you're with a big group now, and you know we are going to make a difference. And
Thank you.
join us and learn more about what our foundation is doing.
Yeah.
So,
Thank you.
Have a great
everybody have a good day.